Mm-hmm.
Oh,
You know, but he doesn't feel good.
it doesn't matter. Even if he feels good, you still do it.
Yeah, he's my baby. He is our son. And you better get it together. If he wants to give you a kiss on the teeth, you take like a bitch.
I think you have Dookie on your shoe. Oh, that's that gum. Did you wear those
Probably.
to set this away?
I think I did, yeah.
Please, it's not hot in here, buddy.
Sit down. You're getting yourself all hot and bothered. Yes, I know. Come on, sit down. Sit down. Sit down like a big boy. Can you sit down? Why don't you lay down?
Thank you, right?
When I need to go bring the Teletubbies and get the almost to that lady. She's like, oh, I'm giving it to my, I have a niece, I think, that's autistic. She's like, oh, she likes to throw them out the window. And I was like, oh. She's like, wait, well, not out the window, but I'm like, yeah, I know what you mean. Just give me the $40.
What?
I'm like, these poor things are gonna be
Yeah.
ripped apart.
Oh my god. I don't care. Do what you want. What that fucking phone is though. Killing me.
I know. I don't know why people are like interested and then don't write back.
Me either.
And I put on it serious buyers only. Don't say.
Yeah, please.
You know what people do? They like the post. Why are you liking the post? Well, are you interested, or are you just liking it because you like it? Like, that doesn't even make sense.
Oh, that's a great deal.
Like, yeah, seriously. Look at you. You're boring.
Right there.
Hello.
So bigger than previously,
Yeah.
and
2 days and now it's
nicely.
So
So
today about an hour ago it just started to see the red.
we're going to set up antibiotics to treat
Okay.
for an infection because
Okay.
no one can do any sedation
Sedation.
of removing a tooth if it's a bad tooth of
Yeah.
a sinus infection. The specialist can, but there's still risks involved.
Mm-hmm.
First, the cardiac consult would have to
Yeah.
say if we could handle the anesthesia or not.
Yeah.
And knowing how bad the
It's
heart
hard.
was before, I don't think anyone's going to
It's
sign
hard.
off on it.
Yeah, exactly.
So I will look again inside the mouth because nothing was very obvious
Yeah,
there. Previously,
last time.
we had taken a small little sample and found just a lot of fibrin, but
Exactly.
something that's growing, it's either infected or it's a tumor that's there, and no one's going to again do any type
Do any
of sedation
sedation.
for tumor removal, but
Yeah.
antibiotics can be done.
Yeah.
And then there's a second one on the left side starting to form.
Yeah, if you feel, I can feel like a little bump.
Which is exactly like the other
That's how
side
that
felt.
one came in.
Can you come from behind just because he's going to back up? I just want to
Yeah,
get
he'll-
the sheet.
Hi, buddy.
He'll bop
It's
him.
okay.
He'll try to back up, but he's fine either way.
No seepage coming around the tooth. But you definitely got bigger than previously.
Yeah. The last 2 days, you can say that it's definitely swollen and
I
now.
thought it was the heat.
And now pus
at
is
first.
coming out.
Now, two possibilities again.
Yes.
A bad tooth or
Yes.
a tumor that's become infected because the skin is stretched. We can
Yes.
shrink hopefully any of
Anything.
it with antibiotics.
Yes.
And if it allows you to do the warm compressing
Yeah.
to attract white blood cells to get there to help fight off any potential
Potential.
infection.
Oh, okay.
So, how has he been with this really hot, humid weather with his heart condition?
He had 2 more seizures.
Yeah. Since we last
They
seen
only difference is they are nowhere near as long as before he started the
They're definitely
medication,
short.
but he still had 2
And it's very
since
random.
the medication.
It's
No
it's-
pattern. And
yeah.
was it this last week when it was 90 degrees? Or
Yeah, one was last week and one was
last week and one was like month or
probably a month.
month.
so it wasn't that warm a month ago. I'm just trying to think again with his heart condition, fainting episodes, having issues with stress
It's-
on his body.
It's usually right when we get up and we say you want to go out, and then
he hears that.
Yeah. I don't
Here's
know
one up.
if he gets overexcited
Yeah,
or
that puts him in a, and then he goes into a breathing fit, and then that's when the seizure will come. So if I don't calm him down in time, that's when the seizure will
Don't
come.
use that word, Dad. I saw what
Exactly.
he did.
Yeah.
Yes.
Don't use the word.
So we've kind of been like especially when we wake up in the morning, we first take them out. We try to let them wake up a little bit to kind of
Slowly get into it.
Acclimate, yeah.
exactly before we get him outside because he has 2
And
younger
he's
brothers.
still being carried to the stairs. He's
Yeah.
not doing the stairs on his own
No,
anymore.
he does do the stairs. He's okay now.
he would carry him sometimes.
Yeah, if I feel like he's kind of breathing a little heavy, I've definitely been babying him a lot more lately than usual. Yes, I know.
You see the seepage on it?
Yeah, because the skin can only stretch so much,
So
so it's
much.
opened up.
Yeah.
Now it has edema coming through.
True.
So we're hoping it will shrink back down with a course of antibiotics. It's never going to disappear. The only way to disappear is having it removed or extracting the tooth if it truly is a bad tooth. We're just trying to
Figure
get
it
it
out.
smaller to buy more time
Okay.
and to get him more comfortable. So compressing if it allows you to. If it stresses him
Yeah.
out, don't worry about it.
Warm water, not
Yep.
cold.
Correct. Warm water compressing. She'll write it all in your paperwork that gets emailed later. Starting the antibiotics twice a day. In his past, before he became a patient here, has he been on antibiotics before? Does he get belly aches from any antibiotics? Do you
He's
know?
not been on any bans, but
No.
he's on the 3.
All the heart medications.
Exactly, and he doesn't have a
He's
problem
fine.
with those.
Yeah.
So if we were to be starting the medication, he gets vomiting or diarrhea, you will let us know. We'll talk about probiotics. We'll talk about other things that if we had to change the medication, just like a person, everyone responds differently to antibiotics.
Okay.
So I do want to get him. Actually, he is small enough to do injections, so it won't interfere with his digestive tract. Even better idea. He's here now, an injectable antibiotic that lasts for 14 days, so you don't have to do any additional pills, and then therefore it won't affect his GI tract. That
Yes.
makes a lot more sense.
Yes.
It's not like he's a 90-pound dog that he gets a huge amount. He's
Yes.
more like a cat size.
He's some
Yeah.
mornings he's great with the pills, and other days he will
No.
sniff those pills
Inject-
out. He'll keep.
I have an injection.
Oh,
What do we weigh
perfect.
today? Do we get a current weight?
14 and a half.
Something.
15 close enough. I will grab what I need for 15 pounds.
Thank
right
you.
back.
None of that can
Awesome.
be taken out, right? Like extracted through a
Well-
needle or something?
Not really.
Yeah.
I mean, it might honestly. It's gonna if you take anything out, it's gonna fill back up.
Yeah.
Yeah. Alright.
So it's not even worth the stress of doing that.
Okay.
Should it go with the antibiotics? How many days should it start going down?
You should be noticing a difference within the first few days.
Oh yeah, how much is this antibiotic anyway, do you know?
It's usually between like 65 and 70. It goes the weight.
Well, it's better than.
Do you want it? I mean, we can give the pill.
What's the difference though really with price?
I mean, it would probably be like $40 for the antibiotic, or
That
40
would
something
be every day.
twice
Well,
a day.
see, he
Twice a
can do this, and for $20, you don't have to worry about it.
Yeah. Let's just do the.
I think it's
let's do
worth
the
it.
And then it's for
And it's
$60
actually-
for the visit.
Yeah.
It's 50. Yeah, 59.
see.
59. All right.
That's not bad.
But it's long acting
Okay.
too. So like the antibiotic, it's like a slow
Yeah,
release
I'd rather
to
do
the body.
the
It's
shot.
actually better than doing the medication twice a
It
day.
won't mess with his stomach
Exactly.
either. Yeah. All right.
Yeah, no, I want to do the shot. That way he doesn't have to worry about it.
He's so cute. His eyes are so expressive. He looks so sad.
Ready?
Ready.
0.7 cc's. Alright, so she's done writing that down. She'll hold you also.
Yeah,
And then
where you want to put it in the butt?
No, it's gonna go in
Oh,
the shoulder.
in the shoulders.
Yeah, Kat's just writing it down, and then we can hold. Keep your head occupied there, Kat, for a second. You're sitting all over Mom.
He's such a good boy.
Yeah,
No idea.
He's
you're a
a
chihuahua.
chihuahua, yeah.
He doesn't even know what happened.
No
It's
idea.
like
That's a
So,
good boy.
Today being on Wednesday, give me an update. No, today's Thursday?
Thursday.
Yeah,
Thursday.
Thursday. Yeah.
Give me an update Monday, Tuesday next week. We know it's on board for 14 days. Get an idea that it is starting to shrink down inside with the
Right.
compressing twice a day for about 5 minutes. Now that the antibiotics, you just keep with the heart medications
Yep.
Are
and
there,
keep
like-
the air conditioning going right
Yeah,
now. It's
Yeah.
that's what
really
we've
heavy
been
air.
doing. Are there eye drops or?
Artificial tears. You can just do artificial tears if he's not blinking very well because of it.
Okay.
I have dog tear.
Dog.
Like
liquid
eye drops. Would that
for
do
dogs.
anything for him?
That-
No.
No, that are you talking about to clean the eye
No.
below or to moisturize?
Just to
Yeah.
moisturize it
Yeah.
because he used to have dry eyes.
Yeah, then
years
that's
ago.
that's fine.
So I bought it for him.
No, that's perfectly fine. You're just
Okay.
lubricating the eyes to add more moisture if he's not blinking as well because of the swelling that's there.
Alright.
All right, Blaze.
Well, at least that will then
that's
settle
a
the
good
GI tract so we
thing.
don't have to worry about him
Yeah,
being nauseous
that's
from the medication.
Good. That's good.
Because you're small enough, you're more like a cat.
All right.
Keep me
Thank
updated
you so
beginning next
much.
week.
All right, thank you.
It's not as bad as we thought.